Good afternoon, everyone, and thank you for joining us today for the Illinois Academy of Family Physicians webinar on lifestyle medicine approaches for the management and prevention of diabetes. And this is being presented by Dr. Christina Wells, a family physician and also IAFP board member. And I'm going to do a couple housekeeping notes before we get started. Here are the learning objectives for today, which Dr. Wells will be going over in a few minutes. Here is the IAFP diversity statement. All of our attendees are in listen-only mode. A copy of the slides and any resources can be found on the IAFP.com/lifestyle medicine webpage. If you have any questions during the presentation, you can add them to the chat feature, and I will read those at the end of the presentation for Dr. Wells. This presentation will be recorded, and all the discussions and questions and answers will be part of the final recording. That recording will be on the IAFP YouTube channel for everybody to access, and it will also be available for CME credit. The Illinois Academy of Family Physicians is accredited by the Accreditation Council for Continuing Medical Education. This webinar has been designated for one AMA Category 1 credit. If you're watching this online, this internet activity is also available for a maximum of one AMA Category 1 credit. In order to receive a CME certificate, you must complete the post-test and evaluation. Here is the link for the webinar. I will put this in the chat function, and this will also be emailed to you at the end of the presentation. A CME certificate is available on this form after you complete it to download. The certificate will also be emailed to you. If you're watching this online as an enduring material, please look in the description of the video for the link to complete the post-test and evaluation. The IAFP adheres to the conflict of interest policy of the ACCME and the AMA. Dr. Wells and myself disclose no relevant financial relationship or interest with a proprietary entity producing, marketing, reselling, or distributing healthcare goods or services. And lastly, this webinar is being supported by a grant from the American Academy of Family Physicians. And now I will stop sharing and pass it on to you, Dr. Wells.
Good afternoon, everyone, and thank you, Kate, for the introduction. And I'm going to share my screen here. So good afternoon again, everyone. And today we're going to be talking about lifestyle medicine approaches to the management, the prevention and management of diabetes. So our objectives for today are to describe the pathophysiology of diabetes, to understand the role of fats and carbs in insulin resistance, to identify the benefits of plant-based diets in prevention and management of diabetes, and to illustrate a Diabetes Undone program as a potential community outreach program. So our first question, is type 2 diabetes preventable and reversible? Although remission, so diabetes is preventable. The Adventist Health 2 study examined disease prevalence by different eating patterns in an overall health conscious cohort. And they had nearly 61,000 individuals in their study. Prevalence of type 2 diabetes decreased in a stepwise fashion with each reduction in animal products in the diet. So with going from non-vegetarians to semi-vegetarians to pesco-vegetarians to lacto-ovo-vegetarians and then to vegans, there was a stepwise decrease in the prevalence of type 2 diabetes. Now, what is remission of diabetes? The American Diabetes Association, the Endocrine Society, and the European Association for the Study of Diabetes and Diabetes UK, they released this consensus statement in 2021, and they defined the remission of type 2 diabetes as sustaining normal blood glucose or sugar levels for 3 months or more, and that was defined as an A1C of less than 6.5% or a fasting plasma glucose of less than 126 milligram per deciliter. So then, is diabetes reversible? A prospective Utah-based study that was conducted between July and June 2011 of 1156 severely obese participants that were between the age of 18 to 72 years and had underwent a Roux-en-Y gastric bypass surgery, there was a 62% remission rate of diabetes that was maintained at year 6. Although this number did represent a worsening of diabetes remission rates over time. Lifestyle-based treatment interventions promoting adherence to a plant-predominant diet and integrated as part of routine care also can successfully achieve type 2 diabetes remission in wellness clinic patients. And so what we see here is that although when you think about like gastric bypass surgery and diabetes remission can be achieved, there are some risks to gastric bypass surgery, such as dumping syndrome, hypoglycemia, malnutrition, vomiting, ulcers, bowel obstruction, and hernias. And also, these individuals may be following more high-fat, low-carb diets, and that can increase their long-term risk for adverse health outcomes such as cardiovascular disease, cancer, and diseases of the GI system. A small study of 59 older adult patients with a mean age of about 71 years showed that when you follow a plant-predominant diet, there was 37% remission of type 2 diabetes. And though the additional studies, though, do need to be done to determine what are the long-term remission rates with both using gastric bypass and lifestyle medicine treatment interventions. But again, lifestyle medicine offers the advantage of having less long-term risk and complications. So we're going to now take a step back and, sorry, give me 1 second. My computer is messing with me here for a second. Sorry, I'm just having a little technical difficulty here for a second. Okay, sorry about that. All right, to understand fat and insulin resistance, we're going to first look at fat absorption in the body. So within the small intestine, dietary fats are packaged into lipoproteins called chylomicrons. And these chylomicrons transport fat around the body. Remember that fat is hydrophobic and it needs a transporter to enter the bloodstream. Chylomicrons transport lipids from the small intestine through the lymph system and the bloodstream and make these lipids available to tissues in the body for energy provision, or they move the lipids to storage sites in fat deposits. The body cells then extract triglycerides from these chylomicrons, and they leave behind cholesterol, a very small amount of leftover triglycerides, and the protein and phospholipid portion of the chylomicron to be dismantled in the liver. There are other 3 types of lipoproteins that you've probably heard of before. They're VLDLs, LDLs, and HDLs. Of note, studies have shown that it's actually dietary fats and not cholesterol, which increases LDL. And LDL delivers cholesterol to the body cells. So that's just a little bit of a review of how fat is absorbed in the body. So then now, again, let's look about fat and insulin resistance. So what happens when someone ingests a meal that is high in fat? Dietary fat, when it's ingested, will delay gastric emptying. So that means that fat enters the bloodstream and is taken up by the peripheral cells at a faster rate than glucose. And this leads to a lag in glucose absorption. As fats enter the cells of the liver and the skeletal muscle, it alters the insulin receptor. And we're going to look at this a little bit more in our next slide. And this causes insulin resistance and prevents glucose from entering the cells. And this results in hyperglycemia. As the pancreas tries to increase insulin production, then this may lead to hyperinsulinemia. So here you see a schematic. And on the left panel, what you see here is that in normal insulin action, insulin will bind to the insulin receptor, and it activates the insulin receptor kinase, which leads to phosphorylation of these enzymatic proteins that we see here, the IRS, the P13K, and the AK2. And what that does is that will ultimately suppress glucose production by the liver, and it will stimulate glucose uptake and storage as glycogen. Recent studies have indicated that in hepatic insulin resistance, this signaling mechanism is defective. And that's what we see over here in this right panel. When there is an increase of fatty acids in the liver, then they will block this signaling pathway. And so in instance, what happens here is that they block the pathway by phosphorylating the insulin receptor, and thus insulin cannot get into the cell. So what happens here is that fats, they come into the cell, they come into the liver, and they say, hey, we're taking space here. There's no more room for glucose, and they're going to prevent glucose from entering the cell. And so this is the mechanism by which diets high in fats will block off that insulin signaling and also prevent glucose uptake into the cell. So here's another schematic where we look at the effect and mechanisms of inhibition of insulin signaling. So what we see is that lipotoxicity is caused when non-adipose cells are exposed to chronic elevation of free fatty acids. And this is believed to play an important role in the development of things such as diabetes, cardiomyopathy, and non-alcoholic fatty liver disease. Lipotoxicity can lead to mitochondrial dysfunction, and then it can activate the novel protein kinase C, and then that will inhibit the insulin signaling pathway. Excessive fatty acids also promote endoreticulum stress, and that also activates enzymes that also will inhibit the insulin signaling pathway. Additionally, inflammation, such as what we see in visceral obesity, will increase the level of pro-inflammatory cytokines, such as TNF-alpha and IL-6, and that will also activate those enzymes, those stress kinases, and that will further inhibit insulin signaling. And so we see that there are multiple pathways by which fatty acids, excess of fatty acids, can cause a disruption in insulin signaling within the cell. So a high-fat, low-fiber diet also can induce intestinal dysbiosis. And this will result in aberrant metabolite concentration that will disrupt the intestinal integrity and allow for leakage of substances such as LPS, trimethylamine, and other metabolites to enter the circulation. And when these substances enter the circulation due to the disruption in the tight junctions in the gastrointestinal cells, then this can contribute to chronic inflammation of the liver and adipose tissue. And this is associated again with the development of things such as cardiovascular disease, insulin resistance, and other conditions that are associated with metabolic syndrome. So this is another way that excessive high-fat diets and low-fiber diets can cause a disruption in insulin signaling, well, not insulin signaling, but a disruption in the intestinal dysbiosis and lead to insulin resistance. So over time, Excessive fatty acid intake can also lead to free radical formation in the beta cell, and this will result in beta cell apoptosis, or otherwise known as beta cell suicide. So there we have seen that there are multiple ways in which diets high in fatty acids can disrupt insulin signaling, can cause inflammation, and can also lead to insulin resistance. So let's think about what are the different fatty acids that we consume when we eat foods. And so there are fatty acids called PUFAs, and these polyunsaturated fatty acids are found in things such as fish, salmon, tofu, plant oils. And these PUFAs have been shown to actually be healthier fats and can prevent and reverse adipose tissue inflammation and insulin resistance. Monounsaturated fats, which are also found in plant oils and avocados, have also been shown to be able to prevent and reverse adipose tissue inflammation and insulin resistance. However, things such as saturated fats and trans fatty acids, where we find those in more of our processed meats, our deep fried foods, these are the types of fats which have less health benefits and have been shown to be more of a contributing factor to insulin resistance. Saturated fats, as I mentioned earlier, also increase LDL. And so it has been shown that it is not cholesterol that increases, it is not an intake of dietary cholesterol that really has the biggest contributing factor to cholesterol in our body, but it is saturated fats which increase LDL cholesterol in the body. So now we're going to shift to talking about carbohydrates. Sorry, my screen is stuck again. Okay. So we're going to talk about simple versus complex carbohydrates. And I think this is really, really important to understand that not all carbohydrates are created equally. So you have simple carbohydrates that are monosaccharides and disaccharides, and those are fructose, galactose, and glucose. And they may combine to form things such as sucrose, which is normal table sugar. Lactose is what we see in milk, and maltose. And then you have our complex carbohydrates. Those are glycogen, starch, soluble and insoluble fibers. Complex carbohydrates are more nutrient dense, whereas our simple sugars or simple carbohydrates are typically found in refined foods. And these types of carbohydrates are the ones that increase blood sugars rapidly when they're ingested. So it's important to note this because not all carbohydrates are created equally. So now we're going to talk about one of my favorite things, and that is fiber. And so there are two types of fiber. And increasing the intake of fiber, which is an undigestible carbohydrate, it offers numerous benefits in type 2 diabetes management. High fiber diets can help regulate blood sugar and lipid levels. They can increase satiety. They can reduce inflammation. They aid in weight management, and they reduce premature mortality. And so again, there are two types of fiber. There's insoluble fiber, which pretty much we can think of as adding bulk to the stool and preventing constipation. There is soluble fiber, which acts like a gel, and we're going to talk about that a little bit more, and it's important. A soluble fiber also slows digestion, and it can lower blood cholesterol. And both of these, both soluble and insoluble fiber, pass through the body without elevating blood glucose, and they aid in blood glucose control and insulin response. And so fiber is one of those really important things when talking about diabetes management. And we're going to break down fiber more and why it's important for the management of diabetes, type 2 diabetes. So normally we consider delayed gastric emptying as an abnormal process. But delayed gastric emptying has a beneficial effect on blood glucose management. Delayed gastric emptying allows for food to be digested more slowly, and this decreases that postprandial blood glucose levels. And so fiber allows for delayed gastric emptying and for slower digestion of foods, which again is beneficial in terms of thinking about blood glucose management. Fiber intake can also decrease caloric intake, and this can result in weight loss and improve glycemic control. And we're going to talk more in the next slide about why fiber will increase and improve, or why fiber will decrease rather caloric intake. And so one of the ways in which fiber will decrease caloric intake is by increased satiety. Soluble fibers may stimulate the appetite regulating hormones, such as GLP-1, I know we all are familiar with that, and PYY in rats and humans. And the intestinal hormone GLP-1 promotes insulin secretion and B cell proliferation. It controls muscle glycogen synthesis, and it promotes satiety. And so increasing fiber intake will actually help individuals to be full for longer periods of time, causing them to eat less. And therefore that can help them not only in terms of managing diabetes, but also help them to manage their weight as well, which is also beneficial for the management of diabetes. In the intestine, fiber forms this gel-like substance that traps nutrients, protecting them from digestive enzymes and slowing down the digestive process. And this results in that slower rise in post-meal glucose levels and improves cellular sensitivity to insulin. And so fiber will form this gel. If you've ever seen like, I think a nice correlation with this is if you've ever made like chia seeds and you put it in water or something else and it will form this gel. Well, that's what fiber is like. It forms this gel and it traps these nutrients, but it also is going to take other things with it like cholesterol and remove that from the bloodstream and help reduce cholesterol levels. But it's going to also slow down the absorption of food again, so that you don't have that rise in post-meal glucose levels, and you're also going to have improved sensitivity to insulin. So fiber also activates incretin secretion. And so incretin stimulates a glucose-dependent release of insulin from the pancreas, and it inhibits the release of glucagon. It also will decrease gastric emptying, and we talked about why that's important, and decrease GI motility. This will also lead to less food intake and less water intake. And so fiber is important again because it activates GLP-1 and helps to control blood sugar levels and helps to improve insulin sensitivity. Fiber also has a decreased glycemic effect. So carbohydrates with a low glycemic index are more slowly digested, they're more slowly absorbed and metabolized, and this again results in lower postprandial glucose and insulin levels. And so things like psyllium fiber have also been shown to improve gastric tolerance to things like metformin. And this is why, again, fiber is not only important by itself, but fiber is also important when used in combination with other medical management, such as metformin, for the use of management of diabetes. Fiber also can work like a carbose, where it converts carbohydrates into a more slowly released low glycemic index form. And this will also have impacts on lowering hemoglobin A1C levels. So this is also one of my most important things that is really, really fascinating to me about fiber and its benefits, and why plant-based diets are important for helping with the management of type 2 diabetes. So fiber helps in the production of these short-chain fatty acids. So our gut microbiota, which are our probiotics, they convert fiber, which is prebiotics, into these short-chain fatty acids, which are postbiotics. And these postbiotics, short-chain fatty acids, are acetate, propanoate, and butyrate. And short-chain fatty acids have many, many health benefits. They can help regulate immune processes. They're anti-inflammatory, they're anti-obesity, they're anti-diabetes, anti-cancer, and they provide cardiovascular, hepatic, and neuroprotection. And so we see that there are many, many benefits of these short-chain fatty acids that are produced by our gut microbes when we ingest fiber. And so it can lead to decreased lipids in the liver. And we saw earlier why having more lipids in the liver can disrupt that insulin signaling. Also, these short-chain fatty acids can decrease glucose production in the liver. In the pancreas, they can increase beta cell function and insulin secretion. In the adipose tissue, they can increase leptin release, and that's important again for hunger signaling and helping us to feel full. It can also increase energy expenditure and decrease inflammation and lipid accumulation. In the muscle cells, these short-chain fatty acids can improve mitochondrial function and also increase insulin sensitivity. And in the intestine, these short-chain fatty acids can increase intestinal gluconeogenesis. So this is another really, really important way of how eating diets high in fiber with a combination with our gut microbes can help to produce these beneficial short-chain fatty acids, which can help to lead to improvements in the management of type 2 diabetes. Okay, so here's just a list of, I'm just going back, make sure I skip a slide. Okay, so here's a list of foods high in fiber. So things such as beans, broccoli, berries, avocados, popcorn, as long as you skip the butter, intact whole grains like quinoa, brown rice, apples, potatoes, and nuts. So these are foods that are really high in fiber and important in the management of type 2 diabetes. I also wanted to say something about fruit, because many, many times I have patients coming and saying, oh, I was told that I cannot eat fruit when I have diabetes. Remember, I mentioned that not all carbohydrates are created equally. And so fruits, although they have fructose and glucose, this fructose and glucose is bound to fiber. And because it is bound to fiber, there is delayed gastric emptying. And so these sugars are absorbed more slowly. And so when you eat fruit, there is not that increased postprandial rise in blood sugars. And so fruits are very, very important for patients who are eating, who have type 2 diabetes, to include in their diets because of the many, many health benefits, vitamins, minerals, phytochemicals that fruit have. So make sure your patients are eating fruit because it's bound to fiber, and that makes fruit actually very okay and very beneficial. Legumes, oh my goodness, I could say so many things about legumes. Legumes are peas, beans, and lentils, and they're rich in things like fiber. They're also rich in plant protein, B vitamins, iron, folate, calcium, potassium, phosphorus, and zinc. They're low in fat. And so they're similar to animal products in terms of nutrients, but they have lower iron levels. They have no heme iron, which can be very detrimental. They have no saturated fat, and they have no cholesterol. So legumes are very, very important also in the management of type 2 diabetes and in regulating blood sugars and insulin sensitivity. So let's talk a little bit about glycemic index. Glycemic index is a measure of how quickly a food causes a rise in blood sugar levels. And so what happens with glycemic index is that foods are ranked on a scale of 0 to 100. Foods that have a high glycemic index are quickly digested and absorbed, and there's a rapid rise in blood sugar. High glycemic index foods are things like you see on this picture here, like donuts, these highly processed foods that are high in refined carbohydrates and sugars. For instance, pretzels have a glycemic index of 83. Foods that have a low glycemic index are digested and absorbed at a slower rate, and they cause a slower rise in blood sugar levels. Typically, these foods that have a low glycemic index are rich in fiber, they're rich in protein and or in fat. For instance, apples have a glycemic index of 28, kidney beans have a glycemic index of 24. However, just to note that low glycemic index doesn't mean that it's high in nutrients. There's an alternative to the glycemic index called glycemic load. And the glycemic load is a formula that can protect for potentially misleading glycemic index by it combines the portion size with glycemic index into one number. Remember, glycemic index does not take into account portion size, whereas glycemic load takes into account portion size and may be a more accurate measure. So glycemic loads that are higher than 20 are considered high, and those between 11 and 19 are considered moderate, and 10 is considered low. And so it's really important to kind of look at the glycemic load, because in this example here, glycemic load for watermelon glycemic index, for watermelon is really, really high. But when you take into account the glycemic load, for a typical portion size of 120 grams, the glycemic load for watermelon is only 5, given its high percentage of water. And that means that a person taking in watermelon, 120 grams, they're going to have a very low impact on their blood sugar levels. And so utilizing glycemic load in addition to glycemic index can also be beneficial in helping to understand the impact of foods on blood sugar levels. So one of the things that we have to think about as we are recommending certain types of foods with our patients is thinking about our nutritional, thinking about cultural awareness. And so our nutritional therapy should be individualized, and they should take into account personal and cultural experiences. And they should be based on really what is important to the patient. For instance, for me, when I'm dealing with my patients in my clinic, I may ask patients what they're normally eating, and then I may give them suggestions of how they can modify those foods to make them more healthy. For instance, I have patients who may eat a lot of greens already. Maybe they're eating collard greens already. But maybe they're putting in pork or some other high fat animal product in their turkey or like turkey in their greens to add flavor. What I can suggest to them are ways that they can add flavor to their greens without adding the animal fats. And so I'm not really taking away the foods that they are normally used to, but I'm helping them to understand how they can eat those same foods in healthier ways, and also for those foods to be flavorful to them as well. Other ways that I have people adjust their diet may be, I may have Hispanic patients and they may be eating tortillas. And so I may recommend to them that they eat corn instead of flour tortillas, and that may be more beneficial. So again, it's important that we understand what patients are already eating, and instead of trying to get them to eat something that may be completely foreign to them, instead trying to help them to cook and prepare some of the things that they're already eating in more healthy ways. And then just helping them to understand how some foods may be less beneficial in terms of managing their type 2 diabetes. So now we're just going to go through a few studies to show the benefits of using plant-based diets for the management of type 2 diabetes. Cohort studies strongly support the role of plant-based diets and food and nutrient components of plant-based diets in reducing the risk of type 2 diabetes. So evidence from observational and interventional studies demonstrate the benefits of plant-based diets in treating type 2 diabetes and reducing key diabetes-related microvascular and macrovascular complications. And so multiple potential mechanisms underlie these benefits, as we talked about in our previous slides, including things such as reducing insulin resistance, promotion of a healthy body weight, increases in fiber and phytonutrients, food and microbiome interactions, and decreases in saturated fat, advanced glycation end products, nitrosamines, and decreases also in heme iron. Studies also show that a plant-based eating pattern is associated with a reduced risk of developing type 2 diabetes and is highly effective in its treatment. Diets that emphasize whole grains, vegetables, fruits, and legumes and exclude animal products improve blood glucose concentrations, body weight, plasma lipid concentrations, and blood pressure, and play an important role in reducing the risk of cardiovascular and microvascular complications. Here was a meta-analysis of prospective observational studies that examined the association between adherence to plant-based dietary patterns and the incidence of type 2 diabetes in adults who are age 18 and older. And these results there were 9 studies that were identified. It totaled over 300,000 participants, and with 23,000 of those cases of incident type 2 diabetes. And within these studies, there was shown a significant inverse association between higher adherence to a plant-based dietary pattern and the risk of type 2 diabetes. And so plant-based dietary patterns, especially when they are enriched with helpful plant-based foods, may be beneficial for the primary prevention of type 2 diabetes. And I think that's important here to note that we're talking about these whole food plant-based interventions, because I have lots of patients who are also eating unhealthy vegan and plant-based foods, and helping people to understand that refined foods are also not going to be beneficial in terms of helping to prevent and also helping to manage or even reverse, in some cases, type 2 diabetes. So we're just going to spend a few minutes talking about just a few other lifestyle interventions that can be helpful in terms of type 2 diabetes prevention, management, and reversal. Exercise improves glucose regulation in an insulin-dependent glucose by increasing insulin-dependent glucose transport. Exercise can also increase insulin sensitivity, and exercise increases energy expenditure, which helps with weight management. Think of exercise as insulin without the needle. And so exercise is as equally effective as insulin in terms of glucose regulation. So exercise is very important in the management, prevention, and reversal of type 2 diabetes. Sleep. We don't really talk about sleep as much as we probably should with our patients, but sleep is so, so very important. Think about sleep as when the body does its housekeeping functions. And if we're not sleeping, just like if we never cleaned our homes and we would have a dirty home, think about what happens when our body never gets a chance to perform its housekeeping functions. And so sleep is very, very important. Insufficient sleep duration can trigger dysregulation of metabolism and increase immune response. And this can result in appetite dysregulation and cardiometabolic disease. And so people who are also not sleeping enough may also be eating more and having other dysregulation of metabolism. So sleep is vitally important to discuss with our patients about when they're trying to prevent, improve the management of, or reverse their type 2 diabetes. Mental health is also something really, really important to discuss. Diabetic patients have worse mental health than non-diabetic patients. There was a negative association seen between diabetes and social dysfunction and anhedonia. And anhedonia was associated with an increased chance of suboptimal glycemic control in patients with type 2 diabetes. Clinically diagnosed diabetes, but not undiagnosed diabetes, was associated with a doubling of prescriptions for antidepressants. And this is consistent with the hypothesis that the associations between diabetes and depression may be attributable to factors that relate to diabetes management. And so individuals with depression may have a 40 to 60% increased risk of developing type 2 diabetes, and co-occurrence of depression and diabetes is worse than when each illness occurs separately. So it's important to address the mental health of our patients as well. Patients who have poor mental health may be at higher risk of diabetes, and patients with diabetes may be at risk for poor mental health. And when your mental health is not, it may be poorer, it's also going to be more challenging to manage your diabetes. So it's really important that we're addressing mental health with our patients as well. So let me talk to you about a wonderful program that we did called Diabetes Undone. Diabetes Undone is a scientifically proven program that can help with the prevention, management, and reversal of type 2 diabetes. So we did this program at a church on the south side of Chicago, and it was brought about by a grant that was funded through AAFP. We had over 30 enrollees, but I would say that at each session we had between about 15 to 20 that actually attended the sessions. We had 6 total sessions. 2 of those sessions were virtually, and 4 of those sessions were in person. The sessions included, so participants were able to join the program for free because of the grants, and they were given a participant workbook, and they were also given a cookbook. And so each session, there were videos that we showed to the participants, and then we had a discussion regarding those videos. We had participants create, what am I trying to say? We had them create goals and share their experiences within the group on a weekly basis. We also had nutrition students that also came out to help. And they also developed materials and presented that to the participants. And we also had live cooking demonstrations from a vegan chef. And so not only were they shown what foods to eat and how they can incorporate lifestyle modifications to help improve or prevent or reverse their diabetes, but they were shown practical ways of how to prepare these foods, how to make them in flavorful ways, and also how to I lost my train of thought there. How to make them in flavorful ways and they were they were also given the opportunity, that's what I was trying to say, of eating them and being able to taste them live. And so it was a really, really good, we've got a lot of feedback about this program. This is a program that can be done in any sort of local community center. It can also be done within a clinic setting as well, depending on how your clinic is set up. And but it's very easy to do this type of program, and it was very beneficial for our participants. Many of them, we checked their A1Cs prior to starting the program on the first day, and then we also checked A1Cs at the end of the program. We had participants measure their weights before and after, as well as waist circumference. Not all participants did the weight and the waist circumference at the end, but for those who did check their A1Cs, we did see that there was a decrease in A1C even within the 6 weeks between the beginning and the end of the workshop. And so it was a very, very good experience. And we're actually still, because participants need support on an ongoing basis. So we are actually still meeting once a month to just provide additional support in this journey as participants are trying to incorporate different lifestyle modifications to help them with their journey with diabetes. And those are my references. And I'll stop sharing and answer any questions.
Wonderful. Thank you so much, Dr. Wells. I really appreciate it. I did put the link to Diabetes Undone program in the chat. It is something that participants purchase. You would purchase the workshop, and then people can join and like purchase work books, but all the information for that is online. So I do have some questions here. The first one, is there a difference between plant fatty acids and animal fatty acids in reducing insulin resistance?
Yes. So as we talked about before, so polyunsaturated fatty acids and monounsaturated fatty acids, which are usually typically found in more plant sources. Now, remember, all foods have all types of fats in them, but there are predominant fats that are present in foods. And so plant foods tend to have more polyunsaturated fats and monounsaturated fats. And these types of fats have been shown to actually reduce insulin resistance and help improve glycemic control. And so they don't have the same impact of creating inflammation and insulin resistance that saturated and trans fatty acids do.
Great, thank you. And then regarding psyllium fiber, does the supplement improve glycemic control? And is it better to take that before, during, or after a regular meal?
Can you repeat the question again?
Sure. Does psyllium fiber supplement improve glycemic control?
So there were, if you look at my references, there are a couple of articles there about psyllium fiber. And so it does improve glycemic control. What I do recommend for patients, however, is when you eat whole foods, you're going to get lots of other beneficial nutrients, vitamins, minerals, other phytochemicals that can also be important. And so I really try to, psyllium supplements can be beneficial, but getting those whole foods are going to give you the most benefit.
Okay, so if they're not doing the whole foods and they're still taking the psyllium supplement, would you recommend before, during, and after a regular meal?
Oh, I don't know that there is necessarily any sort of, I don't know any data that tell about the timing of when you should take it. I think if you're going to take it, but I don't know anything about the specific timing of when you have to take it.
And we have a question asking if you can please address keto diets for diabetes, such as Virta.
So keto diets in the short term do have a benefit of improving diabetes management. So there is benefit in the short term of improving diabetes management. I just wanted to say that again. However, the problem with keto diets is that they're high in saturated fats. And so with the keto diets over time, one, they're not sustainable. And so most people cannot sustain keto diets long term. And also, again, the issue with keto diets is because they're so high in saturated fats and may even be high in trans fatty acids, then these keto diets increase risk for cardiovascular disease. And so keto diets definitely are not beneficial in the long term. However, though, a plant-based keto diet might be beneficial, but again, their keto diets are not sustainable in the long term and increase risk for cardiovascular disease.
Thank you. And can you comment on high fructose corn syrup addition to processed food?
I'm not sure what you want me to comment on, but it's a refined, simple sugar. And so it is typically when you think about high fructose corn syrup, again, it's a refined sugar. It's usually found in refined and processed foods. And it's usually not attached to fiber. And so it is an unhealthy sugar. I hope I answered that question. I don't know what you wanted me to address, but high fructose corn syrup is basically just fructose, and so in high concentrations, it is going to, of course, it's going to cause those, because it's a simple sugar, it's going to cause an increase in the rise of blood sugars after ingestion. And it can also increase inflammatory processes in the body. So it's an unhealthy form of sugar.
Thank you for that. And regarding the Diabetes Undone community outreach, we have a question. Is there anything that you felt improved participation? Dr. Maps has said that they have tried group diabetes classes and have struggled with participation rates.
I think having the cooking portion was helpful. I think that also having the group interaction was helpful. And I think making it practical was also helpful. Constant connection with the group is important. And again, remember, we had 30 participants sign up, but only 15 to 20 actually came to the class. So we didn't get everybody to come all the time, but we still had a nice group. And so I would just say, just keep trying, keep working with it, and don't stop doing it.
And there was also a question on when the Diabetes Undone were done. They were done on Sunday afternoons. So at about 1 o'clock, 1:30. So that might have helped participation too. It was on the weekend. One additional question that came in: would psyllium be expected to help with the control of diarrhea as a side effect of metmorphin use?
You know, that I don't have any data on, but I could say that I can probably, because psyllium is going to bulk up the stool, it might, but I don't have any data to say that I can actually prove that, but I can assume that it might help with that.
Okay. I think we have gotten through all of the questions. This recording is available online, where it will be in about a day on our YouTube channel. That link is in the chat. I will also put in the chat the link to the post test. And I appreciate everybody spending their lunch break with us today. And thank you so much again, Dr. Wells. I appreciate your time and expertise. And thank you all for joining. And before I cut everyone off, I'm going to find that link and put it in the chat. I apologize that I didn't do that earlier. I will also email this to everyone.
I just want to say too, before people leave, is thank you for joining today. And I just want to say it is so, so important that we, even when we're thinking about, I utilize medications for type 2 diabetes all the time. But it's important that we're also addressing these lifestyle factors with our patients, because if we don't address the lifestyle factors, in addition to giving medications, patients will still be at risk for having complications related to diabetes, because we will not be getting at the root cause of why they have diabetes in the first place. So make sure you're incorporating lifestyle modifications in addition to your other therapies that you're offering your type 2 diabetics.
Wonderful. Thank you again. Thank you so much. Everyone have a wonderful rest of your day.
Bye.
Bye-bye.